Everyone, we have Dr. Lewis here. I'm Dr. John. This is going to be a very casual, kind of behind the scenes discussion between the two of us. There's no rehearsed notes, nothing like that. This is going to be just kind of shooting off the cuff discussion of our why.
I think one question you could ask to determine somebody's why is, why did you go out? I know my answer, and I guess our answer, but tell us why you wanted to do your own office with me and not just work for somebody else.
Well, we both worked as associates for 4 years prior to starting our own practice, and there's obviously good with the bad. So you learn some good things you like about some offices and some of the not so good things you like about other offices. What I realized was there was really, there's no way where one office with another doctor was going to 100% align with all of my philosophies and my mindset. And that's why I kind of wanted to branch out and do my own thing.
What are some of those, I know what are some of those philosophies though? Like, we don't know, I know, but what are some of those philosophies?
So one of the philosophies, and I think I've told you before about how my first dental experience was just weird. You know, it's like, I don't even think the doctor knew my name when he was working on me. But one of those philosophies is making the patient feel like they're actually a person. You know, I feel like as dentists, sometimes you just get this tunnel vision where we see a cavity or we're doing a crown prep, and literally it's tunnel vision because we have these magnifying loops where all we see is the tooth. We kind of forget what's going on outside of that. Most importantly, the patient that's connected to that tooth. And one of those philosophies is kind of breaking that lens and seeing like there's actually a person that has emotion, has feelings, that maybe even wants to get to know us, and that I want to get to know them. So that's probably one of the biggest philosophies that I had.
Right.
What about you?
What's happening with our industry in general, like what's happening in the world is, and you probably already touched on this, but things are becoming so numerical and weekly, monthly, annual numbers.
Production quotas.
Right. And like my first job, it was, Dr. Lewis, great job this month, and you feel good, and then the next month it's like, Dr. Lewis, why were your numbers not good this month? And it's just like, I'm sorry, not everybody needed a crown this month. Last month more people needed crowns, and quotas should be removed, in my opinion, from healthcare. I think that's just such a conflict there to say that you need to do this amount of like crowns or fillings or dentures or implants, any procedure, or even a numerical quota. Like, I get we should work hard, and I get one of our main goals is to get patients to say yes to treatment they need. And that's what's nice about our job is we don't have to sell them on something they don't need. Like, hey, do you want this add-on for dessert? Or hey, do you want this upgrade in your car? Like, these are actually things they need. So when patients say yes, it's truly a guilt-free feeling of success. I just never liked having to explain myself as to why things weren't good, and that was one of the main driving things for me. One of the other things is, obviously we have a big focus on the quality, and I'm a bit of a nerd. I do my own readings regarding dental materials. I look into the little safety data sheets and protocols, how to bond, when not to. All the other offices I worked at use products based on probably one or two variables. One, does it work okay? Like, does it work? Is it somewhat, predictable? And two, is it cheap? And admittedly, we, as business owners, you're supposed to look at like, bottom line profits, where can we save? But those are just non-negotiables for me, and I know us. We use materials because the materials work. We use them how they're supposed to be used, and they're better. When you work at an office that a certain material indicates a certain other material to be used with it, and they don't have that, I can't do that. Ethically, I don't feel that's right, and it's just an uncomfortable situation. So I guess it's like, fine, I'll just do it myself, as he says, and we'll go out to our own practice. And that's, I guess, those are like some of the main driving forces for why we're doing this and embarking on this journey. And you don't know everything, but I think if your heart's in the right place and your goal's in the right place, I think patients and people and even your staff start to advocate for you and put the word out there like, hey, these docs know what they're talking about. They actually do really good work. Not that other dentists don't, but you can tell there's something different and special about these guys. And even for the staff, I think it's who doesn't like working for like the best? Like if you know that your doctor's the go-to guy, don't you want to tell your friend with a tooth problem, like, oh, go see my guy?
Right.
Because then you feel good about that referral.
Well, and it reflects on you, like how bad does it make you feel to refer someone where they have a bad experience? So like, let's say someone has plumbing issues. Hey, I have a great plumber, meet my guy, and he wasn't good. It kind of reflects on you, you know, but to your point, if the patients feel comfortable or the staff feels comfortable and they really trust you and they see value in your work and they genuinely believe like the doctor I'm going to or the doctor I work for is the best, it just creates a better work environment, I think, for everybody. And kind of talking, or I guess reflecting back to what you were saying before about production and like how things are like money driven. I think it's even just beyond patients, but even just about people, like whether, you know, it could be any industry, you know, whether it's healthcare, entertainment, whatever. A lot of times we even forget about the people that help run the business, you know, like we have to trust that our hygienist is doing the right work, or that our assistants are going to be there to, you know, make sure the operatory is ready, or our front desk is handling phone calls the right way. And a lot of times, like the backbone to businesses are almost getting shrugged off.
Yeah.
With the kind of, I feel like the trend that things are going, where it's like
everyone's replaceable.
Exactly, everyone's replaceable. It's becoming more corporatized, and it's kind of losing that like family touch to it. And I know you and I, like, we're brothers and we're twins. We have such a close bond, and that bond that we have together, it's allowed us to continue having similar bonds with other people, because that's just the way we grew up, was developing strong relationships with people and not just making things superficial. So I know even our staff, it's like they're more than just our staff, they're our friends, you know. They've gone to your wedding, they're going to mine. It's because we see them more as people. Like by working together, it's like we're almost like our own family. And it's just, I feel like, again, like that's kind of the trend of like things are being broken, is like people aren't being respected anymore by their employers.
And it's like, are we doing something different here? Mm-hmm. Or are we simply just going back to maybe 50 years ago and doing things like that's how it was, or that's how it should be, you know?
Right.
And like, so I don't know, is it new, or is it just a return to kind of that excellence that I think we're departing from more and more?
Yeah. Well, I don't know. That's, I think, one of the reasons why we've aligned so well is, you know, our main focus on treating people like people and developing good friendships and relationships with them and doing the right work, not because it's going to produce higher numbers at the end of the month, but because it's generally the best treatment for the patient. And the interesting thing is, like, I feel by just being honest and showing people you care, that's probably going to be the biggest drive for even more success. Totally. You know, it's like people see success as numbers, and they use numbers to help drive more numbers, where it's like we drive a philosophy, in our why is what drives us to get to that point. Right. And it's just ironic how there's almost like two different ways to kind of get to the same point, but you know, the way that we're aligning is totally different than how, you know, another business may choose to get there.
Yeah. And I think that answers our why for the most part. Like, hopefully we've given you an idea of kind of what we're setting out to change, but our overall goal and vision, and this is again for people that want to be part of our team, this is patients that want to send their family or come themselves and kind of receive treatment here. But I think that kind of everything we've discussed gives a good idea as to like why we're doing this and what our goal is.
Right. And again, this is us just being honest and trying to find a community, like Lewis said, of not only a team to work with us, but also patients to join us that are looking for this type of atmosphere where they know they're going to be cared for, they're going to be respected, they're going to be heard, they're going to be understood, and their best interests are going to be kept in mind.
I'm excited.
Me too. Dr. Lewis,